Hello, Madam President. I know you have been unhappy with the rising healthcare costs. I have reviewed your proposal regarding hiring only individuals who do not use nicotine or nicotine products. Additionally, I have prepared an analysis and my recommendations. As you know, 21 states have legalized an employer's right to hire only individuals who do not use nicotine. Economically, there are several benefits to this type of policy. 1. Smoking has a significant impact on healthcare costs. Smoking-related illnesses cost the United States more than $300 billion each year. 2. Nearly $110 billion of this is for direct medical care and $156 billion is due to lost productivity. Of this, $56 billion is attributed to secondhand smoke impact. Nicotine impacts the immune system. Those who don't use are less likely to call out sick due to cold and flu. Stopping smoking can also lower cancer cases. Tobacco is the most preventable cause of cancer. Some of the cons of the policy may disproportionately harm poor people. Nearly half of unemployed individuals smoke. Quitting is hard and nicotine is addictive. Despite the legalities in 21 states, we could be perceived as a company that doesn't care or is discriminatory. Legally, there may be future challenges against these policies. The American Civil Liberties Union has come out against nicotine-free hiring. They call this discrimination. Some question why companies can demand employees do not smoke, but are not taking the same approach with alcohol use. Alcohol also impacts employee health and productivity. While there are pros and cons which apply to the potential new policy, I believe we should move forward with your recommendation. Why? Consumers believe health and wellness is more important than ever. Companies that elevate healthy lifestyles amongst their workers are seen in a positive light. I advocate that we require nicotine testing as a condition of employment in the 21 states where it is legal. Pre-hire screening will be done via blood test, which is most accurate. Newly hired employees would be required to submit to random screening. This would be handled through human resources and would remain confidential. I recommend the use of random saliva tests, which are highly sensitive to nicotine use. Results of these tests are returned within minutes. If a random test comes back positive, we can require a hair sample on the spot. While the cost of this test is more expensive, it is more accurate. This would provide us with the most reliable results should we wish to pursue termination. I am recommending employees hired before this policy was implemented be exempt. We cannot release employees in good standing for a rule that was not in place when they were hired. We can, however, incentivize them to quit by charging a smoker's surcharge for healthcare benefits. Employees who smoke and were hired previously will need to contribute more to their healthcare. This will help us offset the potential higher costs involved with smokers. We can give our existing workforce in these 21 states a one-year grace period and provide them with a company-sponsored program to help them quit. This approach will allow us to effectively communicate the new policy to current employees who are exempt. It will also give them adequate time to make lifestyle changes. While smoking cannot be used but as a condition of employment for this group, we can still entice them to adopt healthier choices. We will give them a year to change their habits and provide them with the support to do so. This will result in healthcare costs on par with our new non-smoking employees. Overall, your recommendation makes perfect sense for our organization. It will lower healthcare costs, improve employee productivity, and provide us with a healthier employee base in these 21 states. I hope you agree with my approach to implementation. Thank you for your time and consideration.